Hi, I'm Emily from Dermacare, and today I'm going to show you the differences between the Baby Quasar Plus and the Quasar MD Plus. So both of these light therapies target fine lines and wrinkles, skin laxity. They both have 4 wavelengths of light which penetrate the skin to stimulate collagen and elastin. You can go to use these 5 times a week for 8 weeks. And then following that, you then go to use it 2 to 3 times a week. So you're using this on your face for approximately 3 minutes, and then in certain areas. So if you wanted to target your mouth area, you can target that for 3 minutes, and then so on. So the differences between these is that your Baby Quasar is a lot smaller, hence the name. So it comes like this. You do have your charging point, which just goes in there. You've got your goggles, your little cap for your light. So that one's quite small. And it tells you how to use it on there as well. And your Quasar MD. So that one has, again, your goggles, it's got your cap for your light, and you can see that one's a lot bigger. And again, on this box, shows you how to use them. So your Baby Quasar and your Quasar MD Plus do very similar things. Your Quasar MD is a lot larger, as you can see from that. It's also 50% stronger than the actual Baby Quasar. And it takes less time to do the treatment as it's got the bigger head. So ideally, before treating the skin, you want to wash your skin. Make sure it's all cleansed and clean before you do the treatment. So you want to plug your Baby Quasar in first, pop the cap on the end, and then you can turn it on. So it's quite a bright red light. And then ideally do the light sensitivity test first. So you're just rubbing that up and down the arm to see if you get any red or if it's quite irritated. After that, you can then go on to use it on the face. So if you want to, you can use the goggles. You can close your eyes as well, but it's not going to damage the eyes unless you actually look in the bulb. So turning it on, pop it onto the face and work it in small areas. So work in one area for about 3 minutes. After 3 minutes, the light does turn off. So this is the Baby Quasar. And if you were using the Quasar MD, you'd work in a larger area. So when you're actually using it, I'll turn it off now. If you imagine the palm of your hand is enough to cover the MD Quasar, you want to do about half of your hand on the face. You'd do that area, and that area. So you'd section your face into about 6 with the Baby Quasar. And then when you're using the Quasar MD, pop that out. You see it's a lot bigger. That you can treat that whole area. So you can do this bit in circular motions, you can do that bit in sweeping motions if you want to. So with this one, section your face into 4, so you'd work on that area, and then onto the forehead again. And you can treat this area with your cheeks as well. Just be careful of the eye area. It can be treated around there, but just try not to go over the eyelids, as the skin is quite thin and sensitive there. So this one, the Quasar MD, section it into 4, work it for 3 minutes, and then with your Baby Quasar, you're sectioning your face into 6, so section it there and there. So 1, 2, 3, 4, 5, 6, so you're working that in there, and then again you're working that for 3 minutes. Thank you for watching. I hope you've enjoyed my video. If you wanted to purchase this product, then purchase it from Dermacare Direct. Thank you.